Hi, this is Dr. Greg Morris from the Ultimate Foot Store here on Talking Feet again. And today we're going to talk about falling arches. And so a very common problem is that people's arches fall over time. And especially here in Hawaii, because we go barefoot a lot, we wear a lot of flat slippers, we put a lot of stress on the arch of the foot. And so over time, arches do collapse. And so what happens is the muscles and tendons along the foot collapse, and a very important tendon called the posterior tibial tendon goes along the inside of the ankle, grabs onto what we call the navicular bone, and it tends to wear out over time. Our tendons and ligaments are elastic, and elasticity just wears out and the foot will slowly collapse. As it does that, then you're going to experience pain along the arch of your foot, along the heel, and a lot of times the inside of the ankle. And so over time, it gets worse and worse. Then eventually you have to undergo surgery. It's a long surgery and long recovery. So we try to prevent surgery always by wearing good shoes, good slippers, and sandals. So I always tell you the first thing to do is that if your foot or ankle starts getting sore, you start getting falling arches, wear something inside the house. Going around all day long on the hard floors barefoot around the house puts a lot of strain on the arch and the posterior tibial tendon. So buying a nice pair of slippers or sandals in the house, something that has a little bit of cushioning, a little bit of arch support, even a small little heel or wedge helps take the stress off the plantar fascia, the ankle, and the arch. And then once again, wearing a nice supportive walking shoe. That's the best thing you can do. Whether it's a Hoka, Brooks, any other good, nice supportive walking shoe. Once again, when you see a shoe, you want something that's nice and stiff and stable across the midfoot and back the back of the shoe we call the heel counter. And then inside the shoe, you can stick some kind of arch support, and you take the inside of the shoe and stick a new arch support in there too. Once again, anything you do to help support the arch helps take the strain off the ligaments and tendons that support the arch of the foot. Another thing I like a lot, people really love these little plantar fasciitis sleeves or compression socks. And once again, it goes around the arch of your foot and the ankle. And you can wear it with slippers, you can wear it barefoot. I have patients that know dance hula, they wear them there also. Anything that helps support the arch, take the strain off the ligaments and tendons that support the arch of the foot. Besides supporting your foot, when you're sore, well, ice it down. So, if you get done for a long day of work and being on your feet, then soak it. I said ice it down for 10, 15 minutes, is ice pack. You can also soak in warm water. You can kind of go back and forth. If it's painful or swollen, I typically ice it down for 10 or 15 minutes first, but then later on soak in some warm water for 10 or 15 minutes. Is warm water by itself or with table salt, Hawaiian salt, or Epsom salt. That also helps reduce the inflammation. Another thing I really like is we call it diclofenac gel or Voltaren gel. Used to be a prescription gel, now it's over the counter. You can buy it at Costco or Long's or CVS. And basically it's anti-inflammatory like Advil, but in a gel form, and it works really well along the inside of the arch and the ankle without, because the skin's very thin there. And of course, taking natural or anti-inflammatory medication such as Motrin, Advil, ibuprofen, or any kind of natural anti-inflammatory, turmeric, arnica, those type of things also. If the pain continues to worsen over time, the arch continues to collapse, well then I often make custom arch supports. We actually make a mold to the foot, and then you put that in your shoe. It gives you a little more support than our over-the-counter arch supports. And then we do physical therapy, sometimes cortisone injections, and in worst case, surgery. When I do surgery, I fix that tendon, but also reconstruct the arch also. So it's a long process. So once again, if you can avoid surgery by wearing better shoes and sandals and support, much better options. Once again, it's Dr. Gregory Morris, and I'll see you next time.